That means you're extraordinary. You know.
Greetings, everyone. Hopefully you can hear me. Welcome to another episode of Information with Deidre. It is June, and we are going over public health challenges or challenges in public health. So last week we talked about poverty and how that is pervasive in a lot of areas and how it seeps into other areas of public health. And this week we're talking about food and nutrition. And that issue of poverty does touch into food and nutrition, and you'll see why. We'll get into a little bit of that over the course of this live video. As always, folks are welcome to comment. If you're interested in kind of sharing the space with me, I can send you a link so you can, come in. Possibly I could put it in the chat. Of course, all discretion lies with me. If you come in looking a little crazy backstage, then we're going to have to rethink that. Peace, sovereign needs. Welcome to the space. So we'll get right into it. Food and nutrition. So why is food and nutrition important to public health? Well, because it's where it all starts. Just from the moment we are in the womb, right? Because what our mother eats, it really has an effect on us in the womb, especially when it comes to like iron deficiencies, right? So depending on what mom eats and if there's, enough vitamins and minerals going into the diet, that really affects the child. We do have a percentage of children who are born with iron deficiencies, based on what was going on during gestation. So it really is where it all starts. And that's just one example. The other part is what happens internally will always exhibit itself externally. And I think we always see examples of this, right? If we eat, for those of you who like chocolate, I do like chocolate, so I'll say we. So if we eat chocolate, maybe if there's and I'll have to have dark chocolate because I am plant-based, so nothing that has milk in it or dairy. So I don't necessarily always see this with the dark chocolate, but if there's an amount of chocolate that I eat, I may suffer a breakout, right? When I used to eat meat, if I was eating something particularly greasy, like let's say pepperoni pizza, I'm not proud. Pizza face immediately. It'll exhibit. If I eat pizza, my face will look like a pizza, in the next day or two. So it always exhibits. And that's like something very simple that we can all understand when I talk about what we have, what goes internally will always exhibit itself externally. And that stands for a lot of other things too. But right now we're talking about food. So acne is one example. We can all relate to acne and how different breakouts show up on our face based on what's going on inside. For those of you who are into reproductive health, we know that there's a school of thought that says like when we have breakouts here in the chin area and along like the jaw, that there is something going on with your reproductive system. Like, it's a hormonal breakout, right? So let's think about that a little bit. When we think about like hormonal breakouts, like, when we're eating things that do affect our hormones and some of those hormones that do affect reproductive health, like estrogen. So there is a move, we're like knee deep, waist deep, neck deep in this, plant-based movement. A lot of people are, going to plant-based. Some don't understand why. There's not necessarily into research why, but it's a good thing to go into plant-based, but we have to think about the foods that we're eating, making sure that they're real foods and not over-processed foods, right? Because when we get into those over-processed foods, there's a lot of soy-based products. And we know that overindulging, if we take in too much soy, high amounts of soy, it does give us it causes overproduction of estrogen, which can also lead to womb issues like fibroids. So those are things when we're having womb issues, those are reproductive health issues. And sometimes those things can definitely show up on the face when we're talking about hormonal breakouts. So it's really important to pay attention to your body and what you're ingesting and what you're taking internally, because it will exhibit itself externally. Other things like weight, that's also real easy to see on the outside when we're eating too much sugar and fat, things that are high in fat, we'll have some weight gain. So those are things that we can see externally. Unwanted hair. Yeah, I said it. Unwanted hair. And so those can be things that disrupt our hormones. So foods that we eat that cause like hormonal imbalances. Greetings to the chat. Greetings, Sovereign Eats. Peace, Precious Stepney. Thank you for joining us. Please feel free to comment. We're talking about food and nutrition. So, as I said, there's been a move toward plant-based. And so when we're thinking about what we ingest, it's like we can't necessarily eat a lot of overprocessed foods that are use a lot of soy, because that can lead to overproduction of estrogen, which can disrupt, which is, a hormonal imbalance. And some of those things can show up outside, internal to external. So we really have to watch what we eat. And so that's what I mean by, this is all where it starts, because it starts from the inside. Like I said, we have to be mindful. So these things, other than these physical issues leading, coming up on the outside, these things can lead to other health complications and other challenges. And that's why where we make that link and we make that connection to public health. So what are some of the things, some of the issues that come up when we're not necessarily eating properly? Obesity, diabetes, heart disease, and stroke, hypertension. So all of these things lead to issues that require public health interventions a lot of times. And so that's where we kind of move into like the social determinants of health. So what are those? So we'll go over them again. So social determinants of health are, it's the focus of conditions in the environments where we are social. So where we live, where we work, where we play, where we worship. It also is inclusive of age as well. So those are examples of social determinants of public health. And so when we think about these places where we move around, live, work, play, worship, eat is one of them. So what does the food look like where you live? Right? So there's in the nutrition world, there are the two concepts of food deserts and food swamps, very distinct. So food deserts is basically explaining an area that is, there's an unbalanced access to nutritious and healthy foods. And so a lot of the times that has to do with like, whether these places have grocery stores that are within, access to the people that live there, whether it be rural or urban. There's just a lack of access of nutritious and healthy food. Sometimes it has to do with not having grocery stores that are nearby where people can get to them. When it comes to food swamps, that is distinctively an overabundance of unhealthy foods. So, we know that there are a lot of programs that a lot of public health prevention programs that do try to make sure that there is an increase and start working on healthy foods in neighborhoods. And so while there may not be large grocery stores like you might have in like some areas, in an area like a city like New York City, there's, work programs that work with bodegas to make sure that they're carrying more fruits and vegetables, expanding what, SNAP benefits and WIC benefits, women, infants, and children, what those benefits cover, and expanding, the coverage of like more healthy foods so that families who are underserved or living in underserved areas can have access to those foods. So there are programs that do that. Unfortunately, we have to fight against, large corporations and industries that, really maintain their bottom line, that's their total goal. So I do have a lot of my advocacy experience in the tobacco world. And so I'll give you like a concept. So when we are talking about tobacco, there's always like this proliferation of tobacco retailers in areas that are underserved. And it's kind of like, we call it like a tobacco swamp. And we're trying to coin the term tobacco swamp. So, and it's kind of pulling after the food swamp. And it's like, the more you see, it comes from, evidence-based information that shows that the more people see, the more likely they are to start smoking if it's a young person who hasn't smoked, or the harder it is for people to quit. So you can take that same kind of context and switch it over to the food. If there's an overabundance of unhealthy food, what kind of triggers are we experiencing when we see and smell foods A lot of the times it's questionable whether they can be called foods, and there's plenty of documentaries and things that you can watch to edify yourself even further. But what is being triggered inside of people when they see and smell, those foods, because there's an overabundance. There's not like, this plethora of fruit stands everywhere. Maybe on some places, like, there are some commercial strips in New York, for example, where you do have a large amount of vendors on the streets and they're fruit stands, and they're selling fresh fruits and vegetables. But that's not the case for every neighborhood. So when you have, like, certain restaurants, and we won't mention any, but because we're not going to give any like sponsorships or space to those places. But when you have more fast food restaurants than you have healthy places to eat, it does cause a little bit of a problem. So here's another example, especially when you're talking about underserved areas. If you have a family of 5 who, is what we, struggling, there's, low income. If you're passing by a place that says, like, well, we can give you 13 pieces of chicken, and this is if you're still eating meat, 13 pieces of chicken for $11.99. When I was still eating meat, there were those deals that, my family and I took part in. 13 pieces of chicken for $11.99 versus spending, almost $12 on a healthier meal that may not feed everyone. So, the thought process is, well, people can, at least the family members can at least get 2 pieces of chicken or 2 pieces of meat for dinner, rather than like that salad that you may be able to buy, because it's much cheaper to make your own salad, right? But there's the thought, will everybody be satisfied? Also, how many of us have thought that we had to put some sort of meat in our salad? Like, I know when I used to eat meat and fish, the salad was not complete unless I had tuna or some sort of chicken or some sort of additive to make it feel like a meal. So again, we're thinking about those triggers that we have when it comes to how we eat and what we eat and why we eat it, and what it costs us, whether it be economically and our health, which is also connected to economics, which I'll share some information about later. So we just discussed greetings, Akuya. Greetings. What is wrong? I'm so tongue tied today. Greetings, Munira. I'll go into the chat a little bit. Precious says, yes, food deserts and swamps are a true challenge for many low-income communities. Absolutely. You run into that dilemma, especially for families or households, I'll say, where there is a single parent. Like, am I going to use my money that's dear and precious to me, to purchase food that may not stretch, or I think may not stretch, or am I going to purchase something that I know that's tried and true, because there's an overabundance of it, and I haven't necessarily had the opportunity to learn about how to utilize and look at and learn to eat different foods. So that's like a problem that we have in low-income communities. So those programs that do aim to address, teaching communities. So it's not enough to just, work with the retailers to have it. You have to kind of get that information out to the people so that they know that that food is there. So how do you incentivize them to go get these food? You have to like work with farmers markets and work with the corner stores and bodegas, to have incentives to give to families and households so that they can, learn how to eat. And then also with that, have educational workshops that teaches people like how to eat and like how to make like a balanced diet. And again, it doesn't necessarily mean that you need to try to convert people to being plant-based. However, it may be a good idea to have those days where everything is plant-based, so that people learn how to not have like meat with every meal, because there's a lot of hormones in meat. So that also puts us into learning how to like read labels and think about what we buy and where we're buying it from, like learning about brands and who's doing what, right? And that's kind of getting into like the big agri and large food, which can also kind of pull us into environmental health, which is also part of public health. But we're going to stick to the food today. We'll do the environmental part another time. But that part of the environmental health that does, still seep into what we're actually ingesting is when we're thinking about like industrial farming and large farming, the pesticides that are used that also can be carcinogenic, and those work their way into the food. So it goes back to what I said about, being aware of the brands of the food that we eat. So when we're shopping, what is this company? So I would even say before you go shopping, food shopping the next time, think about some of the items that you purchase all the time and, look them up. See where they, who are their partners, what farms do they work with that supply their food? What kind of preservatives are they putting into the food so that they have longer shelf life? Or if it's frozen food or something like that. So these are the things that we have to think about. It's the food swamps, the food deserts, and particularly that overabundance of unhealthy foods. So it's kind of the same as like the tobacco. Every time you figure out a way to like curtail the unhealthy things that they're putting in place, there's something else that they do. So with the food world, it's like, yes, we figured out, programs to make sure that we have healthy programs, but then we have the fast food industry that will just, keep slamming underserved neighborhoods with just like crappy food to eat. And I'm going to say it, crappy food. And I had to get there even personally myself to realize like, this is just not what I should be eating. Is it hard sometimes? Because for a person who spent like the better part of my life eating food that wasn't necessarily helpful or nutritious for my body, it becomes like there are triggers that you still have, and I may have them even for the rest of my life. But because now I have more education and knowledge about what's good for my body and what's bad, that's what helps me stay away from it. So this is why that education and giving people that information of like foods and what they do on the inside and how it exhibits in the external is really helpful. You have to make those real time and real world, real life connections for people in order for them to kind of see how it connects to them. It's not enough to just say, this is bad for you to make you fat. Like, I think people want to know like the ins and outs of how that kind of happens to them. When we think about like what they put in the food, let's take high fructose corn syrup. That is one of the leading ingredients in so much food, and it's nothing but pure sugar. And what that does is, on a biological level, it actually can fool the gut into thinking that you're not full. So those triggers to tell you when you're full, they're kind of shut off because of this overabundance of high fructose corn syrup. And then you just keep eating. What happens to that? That leads to things like obesity and diabetes. And when we think about obesity and diabetes, here are like a few stats. So almost 20% of young people aged 2 to 19 are obese. 40% of adults in the US are obese. Obesity in and of itself, it actually costs the US healthcare system over $147 billion a year. When we think about diabetes, which a lot of the times is a result of obesity based on like, the high intake of sugar and things like that, type 2 diabetes, which, we do have a lot of people, like most people in this country, not most, a lot of people, I would say the facts say 1/3 of people in this country are actually pre-diabetic, and 80% of them don't even know it. And for those people who are diagnosed with diabetes, there is, I think the percentage is about the 40%. I'll put it in the description box below if I've misquoted that. But diabetes actually costs the U.S. Upwards of 300 billion per year. Diabetes can also lead to heart disease and stroke. But one of the main causes of heart disease and stroke is hypertension. Hypertension is caused by what? High sodium intake. All those things cost billions of dollars for the healthcare system. And when we're spending this amount of money, what happens with public health? Then we also have to spend more money for prevention and education programs so that people can understand that this is why we have to curtail some of these behaviors that cause obesity, heart disease, diabetes, hypertension. And a lot of the times we have to do that in underserved areas. Why? because there's an overabundance of just unhealthy food. So you can see where there's a lot of correlation with, you know, um, poor economics, like people, areas that are not necessarily economically mobile or need that economic mobility, and are underserved when it comes to food and nutrition. Sovereign Needs says some states, such as West Virginia, are currently proposing a right to food amendment. Food sovereignty and freedom from hunger is still an issue in many states. Absolutely. Not everything, not all the problems are in the inner city or urban areas. Rural areas have, a lot of these problems too, because especially in that Appalachia area, we know that there is much poverty in that area, and that's not necessarily the inner city. And there's a lot of poverty when it comes to that area. A lot of sugary drink intake in that area. So that's causing, in addition to the obesity and diabetes, what's happening with the mouth? There's tooth decay. Are these people having access to healthcare to address these problems? And so the food sovereignty piece, why that's important, is it's learning how to farm, how to cultivate your own food so that you're free from depending on having to get to that grocery store that you may not have access to, or having to depend on the commercial strip that may be near your town, if it's a rural area that has nothing but fast food and soda and sugar and salt to give you. So that's why the food sovereignty is a really great idea. You can have, there are programs and organizations that teach food sovereignty and learning how to garden in urban areas as well. Check out the True Health Live podcast. I believe it is episode 11, where we talk about healthy things, and we definitely discuss urban gardening and herbs and all the things that you can look at and learn about to keep yourself healthy, and thinking, what you're ingesting, because it definitely exhibits on the external. So absolutely, thank you for that. Sovereign Eats, food sovereignty. So teaching food sovereignty to young people and neighborhoods is definitely key. That's part of that education and information that's much needed. There was something else that I wanted to point out. Yeah, so when we're thinking about like even these fast food restaurants, a lot of the times, it's connected with that industrial farming. Like, what results out of that is like the cheap, low nutrient foods. So, it goes back to how I said, like, what are you buying? Are you looking at labels? Do you know what's in the supply that you're getting when you go to that local fast food restaurant? Do you know where they get what farm they source from, what goes into, what other additives are going into the meat to stretch it so that they, for their budget, they can make more meat patties out of one cow, or if they're making all meat patties out of one cow, if it is all cow. Are you understanding that? Like, it's very good to like do your research, because this also will help, kind of move you from the unhealthy or that overabundance of unhealthy food. Sovereignty says, or should there be more funds to support pantries? Maybe so. Pantries. What do you? I'll say this. I'll ask you to elaborate a little bit further, and I'll say, like, a lot of the times communities dedicate to food pantries, and also it's a lot of the times some of these large grocery stores. But again, what brands are they using to give to pantries where people are low income and underserved? Are they getting the top notch? Because we know that organic is not necessarily the cheapest to afford. So we do have to acknowledge that, everyone can't afford organic. This is why the food sovereignty that you suggested earlier is a really good idea for educational programs. And if it's not organic, how do they shop for like fruits and vegetables so they're optimizing like their time in the grocery store and not necessarily going for these over processed pre-packaged foods? Because one of the things that we know, like a lot of the foods that are a result that end up in resulting in giving people like hypertension and diabetes, is because it's like high sodium. 70% of the food, 70% of these high sodium foods are prepackaged, over processed, and they're store bought. That includes like the fast food restaurants. Even if it's not that, what do they call it? The casual dining places too. So if you're thinking, if you take thinking about the neighborhood bar and grill and places like that, they're included because all of that food is heavily processed. So if you don't know where it actually comes from, you may be harming, yourself and like the balance of your hormones and biological balance like of your body. So you have to be very mindful of, where places are getting their food from. And a lot of the times when you find out what's in it, it's very sketchy on how it's being called food. Right? So if it's not even food, then there's nothing nutritious about it. It's just something that's edible. So we have to really think about that. And again, all of this is public health related because it's about educating ourselves of what we ingest so that we, can curtail different outcomes, negative health outcomes like diabetes and obesity and heart disease and stroke and hypertension. So all of those things are related. And again, it goes back to those, that place-based, as those social determinants of health. Some of these shape the conditions and where we live. If we're, allowing like more fast foods to come into our neighborhoods, because you do have a say in that. Many times when businesses want to open in your neighborhood, they have to seek approval from a body, a legislative body, whether that be the city council, some county level seat. And if you're not necessarily involved, you don't know that these places are coming. So you have to really be mindful about being engaged. So this is that advocacy piece, being engaged at that level, like civically, so you know what places are coming into your community and why. If you already have in 4 blocks, 8 different fast food restaurants, and it's definitely possible, especially in very overpopulated urban areas. You don't need 9 and 10. You don't even need the 8. 1 is enough, actually. And my own personal opinion, it should be none. But I understand we all have our vices. And again, and that's also a public health issue. We can get into that later. But you don't need them. So, we have to be mindful of like, what are the advocacy steps that we can take to curtail these things from happening in our neighborhoods. So I'll just like recap. So we talked about like, it's important to understand why food and nutrition is a part of public health, because it starts at the beginning. What we ingest, what's on the internal will always exhibit on the external. What are some of those external things that exhibit? Acne, that can be connected to your beauty industry. Everything is like, intertwined. Acne, overweight, obesity, hypertension, unwanted, when I say unwanted facial hair, those are all signs of like hormonal imbalances. They also lead to, negative health outcomes, which I said before: obesity, hypertension, heart disease, stroke. These are all things that I've seen personally in my own life with blood relatives. So these are, things that we have to stay away from. Thinking about like the overabundance of unhealthy foods, which we call food swamps, in particular neighborhoods, and how they affect more underserved or low income neighborhoods than more affluent neighborhoods. In more affluent neighborhoods, maybe those things are on throughways and freeways that have like commercial freeways and throughways that have businesses like that, but they're not on the corners and in the small town commercial strips in such abundance as they are in lower income neighborhoods. We talked about food sovereignty being, one of those things that can address more education for people to, have more autonomy over their food and what they eat. I'll go back to the chat really quickly. I missed the previous comment. I see. So Sovereignty said, before she said, or should there be more funds for the food pantries? That happens so quick. So SNAP, as you have mentioned in previous episodes, helps to supplement the food budget for many families. Do you think an increase in state SNAP budget will help? Well, that is a part of public health. I think an increase definitely could help, especially if it is used and budgeted properly. If it is increased to allow for more families to buy organic, absolutely, because as I said, organic is not necessarily cheap depending on where you are. So if it allows more families to be able to afford organic, then yeah, we can increase the budget for certain things, like SNAP benefits for families who are eligible to receive SNAP benefits. And like I said, when it comes to the food pantries, a lot of the times that is, whether it's like donations from private citizens or donations from big food companies. But again, check out those brands. What are they using? Like, we have a food pantry near where I live. Not a food pantry, but it's like food distribution, and they use like this community center, like a rec. It's like like a rec hall space, and every week they donate food. Like families can drive up and they have pre-packaged bags, like many places all over the country, as we experienced through the COVID-19 pandemic. You can drive up and get the food, and so a lot of times what's in that is pre-packaged, store-bought, frozen food. And so we know that that's a lot of the times that's the food that has a lot of sodium in it. And what's happening is they're giving it to everybody who's in the low income communities. So then we end up in this cycle where we're right back to these communities having to deal with negative health outcomes. Yes, there was free food given to them, so it helps economically, but in the long run, what is it doing if it's only contributing to the unhealthy food that they've been ingesting all this time? So working with food pantries so money to food pantries that can give healthier foods and work with places that give healthier foods, which leads me into the farmers markets. So other programs that are really, really awesome are programs that work with farmers markets. Because the other thing is, like, especially if you're in the inner city or urban areas, you're not necessarily going to have access to a local farm. You have to drive out a little further. Most times, if you live in the urban areas and the inner cities, everybody doesn't have a car. So that's that access issue. So what happens is you have to kind of learn, like, to do some research to learn like when and where farmers markets are coming in your town, so that you can go to those places. Because a lot of the times they will, have deals and things on fresh fruits and veggies when you go to those areas. So there's definitely plenty of spaces that you can look, and make sure you're looking, on your town website or whatever, because as places are opening back up, you want to be sure that people are actually reopening some of these spaces for the farmers markets, and like what the rules are, so that you can protect yourself. Most places are definitely going to still have like the universal precautions with masks and social distancing. So you want to make sure that you are finding out where a lot of these places are, because farmers markets are great, especially if you are not in more rural areas that are near farms. If you are there, sometimes you can go to farms and they actually do sell their food on the premises, and those are definitely places that you can go and get healthy foods. So these things are out there, but it's all about like the knowledge of where you can find them, and access. So for people who are in more urban areas, learning about food sovereignty and how you can cultivate your own food, even if you live in an apartment, learning where those farmers markets are, and when they'll pop up. Maybe if there are programs and ways to get to the more rural areas, if you do have a car, finding out where some of those local farms are, that you can go visit them. Another thing is, when you are shopping in the grocery store, pay attention to the kinds of fruits and vegetables and how they look and where they say they come from. Sometimes grocery stores, or those farmers market type grocery stores, they do get their products from local markets, which means that it hasn't traveled far. So that means it's more fresh and there's less of a chance of preservatives in that food. So those are the things that we want to pay attention to. A great place to go in the chat is Sovereign Eats. She has so much information on that with regards to like the places you can go and methods you can use to increase the benefits of what you're eating and nutrition. If you're looking on, maybe this discussion is making you think about transitioning, and she has a lot of different information, like really cool information on how to do that transitioning, learning how to work with a coach to make that transition to eat healthier foods. So I would definitely say visit sovereigneats.com for more of that. So back to how this is, a public health issue. And what are like I'm going to continue some real-time actions you can take. So we talked about like if you live in an urban area, if you live in a rural area, learning about food sovereignty, maybe visiting some of those farms and like purchasing food near where you live if you have access to those farms. With food sovereignty programs are absolutely a wonderful idea. I'm gonna go to the chat. Aquia, greetings, Aquia, and greetings, Kashia. She said, I don't know. I didn't know we could find out what farms fast food places use. You have to do your research. So if sometimes it means you have to make some phone calls, and some businesses, they will tell you like where they source their goods from. I think someone in the chat, and I'm going to ask her to share some of that information. She has done that before, but Aquia B said, we shouldn't be eating fast food. I'm going to say that to you. We should not be eating fast food. But, and here's the other thing. If you can't, then maybe you shouldn't be eating it. If they are not going to disclose to you what they use to put in their food and how they make it, then that's a good indicator that you probably shouldn't be eating it. And most likely it's just something that's edible and not necessarily nutritious. And the lid has been blown off of many of those restaurants. Again, we won't name those names, but many of those fast food places that are very popular and have long-standing presence in this world, I would say, at this point. So if you can't get what they're using, that's a great indicator that you should not be eating it. Sovereignty says, yes, many urban farmers markets accept EBT and SNAP as well. Thank you for that. They absolutely do. And so that is an example of expanding the budget to be able to, make provisions for giving the farmers like subsidies or whatever so that they can actually afford to give some of their fruits at a discount if they're going to accept like the SNAP and the EBT, which is the same thing. The EBT is just a card. This is good to know. Yes, very good to know. So more action. So another thing we talked about is like, just being mindful of what's in the food. Be mindful of the brands that you're buying. So before you go grocery shopping again, be mindful of the brands. Think about what you actually buy and look at the nutritional value of what it is, and not just the nutritional value. Don't stop there. Go further down and look at the fine print and look at the ingredients. And that should tell you. If you ever see something that says high fructose corn syrup, it's probably best not to use it because it's just no good. It is linked to all the things that we talked about before: hypertension, diabetes, obesity, heart disease, and stroke. High fructose corn syrup is never good. It's just another word for sugar. And I'm going to say it like that because it means a lot of sugar. Things that are high in soy, like things that are over-processed, because it messes with your hormonal imbalance and can create an overproduction of estrogen. And so these are things that are definitely related to public health because of the I'll say it again, because of the negative health outcomes that they cause. And so this is related to public health because then there has to be this upstep, this increase of education and funds put toward prevention to make sure that communities are educated about what they're ingesting. So that's all we have for today. I'll put information on where you can get more information about like our food print, as some people say, like information on like what food deserts are, food swamps, even like some of the information that, talks about like the industrial farming and the pesticides used and how that kind of leaks into overall health. And definitely some information about the stats on when it comes to these negative health outcomes. CDC.gov is a really good website to use to learn about the health outcomes and stats of the U.S. So with that, I'm going to go good. Greetings, Chief. Thank you for joining us. I don't necessarily see any more comments. So with that, we're going to close. So this has been about food and nutrition and really its connection to public health. So we went over the gamut of making sure you look at what you're buying, making sure that you question brands that you buy and what, how they source their food. Looking more into food sovereignty, learning about food sovereignty and programs that help with that education and information, looking into farmers markets, utilizing them much more, finding out where they are, finding out about where the farms are. And I think that was it. So that's all we have for today. Thank you so much, everyone, for joining us. And you can catch us this Thursday. We'll be coming back with our public health career spotlight. As always, you can follow me on deidresully.com. Make sure you check out the True Health Live podcast. All the links to the social media and everything is down below in the description box. Make sure you click like, share, and subscribe. If you're joining this live or this broadcast after the live, please feel free to leave any comments or questions, and I'll be sure to get back to you as soon as I can. You can also send in requests for different information with Deidre subjects at deidresully@gmail.com. I'll, definitely make sure to read all suggestions and requests and, kind of peruse through them and see what makes sense to go over. So with that, thank you so much for joining us, and we will see you in the forward. Peace.